Hello and good morning, everyone. Thank you so much for joining us today. I'm Simone Crawley, and I'm the Volunteer Program Manager here at the Dalí. This means that I'm the staff member with the very lucky role of working closely with our volunteers, including our volunteer docent that you'll be learning more from today. The Dalí Deep Dive program series that we are all gathered here for does take place in April for a reason. April is Volunteer Appreciation Month. And this series will feature a docent lecture every Thursday morning throughout April at 11. And this will give a chance for our experienced Dalí docents to dive deep into aspects of our museum's permanent collection. These lectures will feature an opportunity for our docents to delve into a Dalínian subject of their choice. While we are all gathered here, I couldn't pass up the moment to share a little bit about the museum's volunteer program. Just a reminder, April is Volunteer Appreciation Month, so if you're interested in becoming a volunteer, it is a great month to do so. In the Dalí Volunteer Program, our volunteers help out with a wide variety of different departments, including our visitor experience team, education team, marketing, even museum operations. Our volunteers help us every day to fulfill our museum's mission of educating and inspiring our public. We literally could not do it without them. I do want to share that our museum's regular volunteer program is open to new volunteers ages 16 and up all year long. In addition to our regular volunteer program, we also have exciting opportunities coming this summer. So the Dalí will be hosting for its 5th year the Summer Volunteen Program. This is a program open to high school students ages 14 and up that introduces students to the world of volunteerism and also gives them a chance to explore a little bit more about museum careers that they could be interested in the future. The application for this program is already live on our museum's website, and the deadline to apply will be May 31st. If you do want to learn more about our museum's volunteer programs and opportunities, please feel welcome to explore our museum's website, thedalí.org, or on your way out today, if you ask for Simone's card from our admissions staff, they'd be happy to give you one, and I'd be more than happy to answer any questions that you may have. I do also want to highlight our museum members, of course. Please consider becoming a member today. It is thanks to our members that programs like this are possible here at the museum. And as I've already mentioned, we have an exciting month to come with more lectures to come. So we are here today gathered for Dalí in Medicine, and then you can see the rest of the month we will have different featured topics for each Thursday morning, and these are all available to sign up for in advance on our museum's website, so please feel welcome to book your ticket today for a future Docent Deep Dive. But now I have the honor of sharing a little bit more about the docent that I'll be sharing with you today, Andrés Martí-Grau. Andrés is originally from the Dominican Republic and has completed 22 years in academic medicine in the US. He began his medical journey in Virginia and stayed until 2016 when, to fulfill his wife's wishes of warmer weather, he made the move to Florida and has since worked at St. Anthony's as a hospitalist. As a natural educator, Andrés' main passion outside of patient care is teaching in the medical field. This passion has gained him numerous patient care, quality, and teaching awards. He's also published numerous articles in peer-reviewed journals with residents and students. At this time, Andrés serves as the chair of CME in St. Anthony's Hospital and is currently starting to help an internal medicine residency in St. Anthony's, where he is an interim program director. As you can see, Andrés really knows what he's talking about. In his personal life, Andrés has 2 sons, 2 dogs, and a wonderful, supportive wife. We've been lucky to have Andrés as a Dalí docent since 2023. Please now join me in welcoming to the stage Andrés Martí-Grau. Happy to share there will be time for a Q&A session after today's lecture, so feel welcome to hold those questions, and thank you for sharing with us today, Andrés.
How can I follow that? I'm such a wonderful, bubbly personality. It's a very hard act to follow. Huh? Thank you, Simone, for what you do for us as volunteers here. Thank you all for joining me, and thank you for everybody that's joining us virtually from Morton Plant to St. Anthony's from all the way from Virginia down to Trinidad and Tobago. It is my pleasure to talk to you today. I am very humbled. Before I go on, I gotta say that there's gonna be very disturbing images, medical images, and I will prompt you before I do that, so you look away if you think you cannot see them, okay? Well, thank you again. It is truly an honor to present three things that I'm very passionate about, which is healthcare, Dalí, and teaching medical students. It's hard to merge. No, it's actually easy to merge these three fields, and it's you can skin this cat many ways. And talking about medicine and art, or art in medicine, is not the objective of this talk, and it is not my objective either to approach other arts that is not illustrative arts in healing patients. My objectives are, let's see if I can get this. The importance of visual arts in medicine, Dalí's involvement in medicine and research, the potential role of visual arts in teaching healthcare, and use of Dalí's work to teach pattern recognition, problem list, and assessment. But most of all, give you a reason why I think it's important to bring medical students and PA students to a museum and teach them healthcare. Unfortunately, I don't have any financial disclosures. I work in a wonderful, wonderful company by the name of Optum. I am lucky that I have been assigned to St. Anthony's, and I am so lucky to receive PA students from South University. I do work for a company called, because my wife lets me do it, Incorporated, but just on a side joke from that, it is through her support that I can do this. And we just had Doctor's Day just past Saturday, so I'd like to dedicate this lecture to the women that heal us, teach us, and are in healthcare. This right here is Gala. And Gala was his muse, his wife, and in a lot of ways his health taker. Dalí wrote in the Unspeakable Confessions, "Through Gala I acquired not only the right to my own life, but the male and female part of my genius." This right here is my Gala, my muse. And here is Saint Philomena and this icon. These are the three Orthodox saints considered to be the female mothers of female physicians. This, in a way, is a circle. This is a wonderful thing for me to do in front of you, and I'm a little bit emotional because this all started, my passion for Dalí and my academic interest started right at the same time. I was in the Dominican Republic in the early 90s, and this wonderful, most humble, the most intelligent person that I know, Dr. Tania Vargas, was telling me about this museum in St. Petersburg that's fantastic, and this is the postcard, and she showed me the double images, and at that point in time, I was studying DNA and Watson and Crick, and I was going out of my mind, you know? So it is a true honor to do this today. As a form of introduction, a historical introduction of the importance of visual arts in medicine, let's start by saying that it is through visual arts that we have been able to show what medical tools we have used. So, for example, we have the stone papyri that was used in Egypt that was found in the Temple of Kamboambo. It is through the visual illustrations that we're able to show what musculoskeletal manipulations we do in healing, such as the example here of a mobile votive depicting Asclepius, who is considered the Greek god of medicine. With the invention of paper, of course, all medical illustrations continued with that, such as the example here of conventional or non-conventional medicine, such as the map here of acupuncture. Through the medieval ages, in the Dark Ages, we were not allowed to perform dissection because the body and soul were considered one. By the Renaissance era, only physicians were able to perform dissection. but there was limited recordings. It is with great risk that our masters anatomists were able to do so. That I am aware of, the first one recorded was Antonio Paloinolo, and he was heavily sponsored by the Medici family, and he did secretly dissections at great risk. Also, Leonardo da Vinci did a lot of secret dissections. He used to acquire bodies in secrecy to do these drawings. And even Michelangelo, and even in the Capilla Sixtina, we have this double image proposed of the brain and brainstem. Throughout history, it is based on what the artist anatomists have illustrated for us, that us physicians were able to study and dissect and understand anatomy. And you would think that with the invention of photography, that would have been taken away, that we needed no longer the artist, but that was further from the truth, because it was through the innovation of artists such as the very famous Frank H. Netter, who was a surgeon and then an artist, that we were able to study and we were able to understand things that were being talked about. Let me give you this example. This lady right here, she has hypothyroidism and she has a condition called myxedema. You can see that he has drawn her perfectly looking lethargic. Look at the dry skin of the elbow, look at the swelling of the lips, look at the swollen tongue and the indentation where the teeth are. Here we have a drawing of his with emphysema, obstructive pulmonary disease. Look at the clear agony that the patient has, the contraction of the neck. You can even see his drawing of the space between the ribs called intercostal retraction. Then comes our Dalí. And how was he influenced by anatomy and disease? This, no words. This is the study of Christ of St. John of the Cross in 1951. And for those of you, you think you have studied this, I have tried to study this and replicate this, but my art is more abstract, I guess. This is an example of flexion, extension, internal rotation, abduction, abduction. I can go on and on. I mean, look at, for example, here, you can see his right breast. You can't see his left breast. Why? Because he has more contracted his trapezoid and neck muscles. You could easily see that. Why? Because maybe this arm was extended more, and he plays with the shadow, showing us that this is more internally rotated than this. And I can go on and on and on about his knowledge of functional anatomy and why this is depicted like this. And you could already see how I can bring a student. I'm not going to keep a patient like this, standing like this for hours, right? But I can bring a student to a museum to review that and look at asymmetry and maybe try to identify an injury. Let's go back to our Dalí before we go on to medical students. Salvador Domingo Felipe Jacinto Dalí y Domenech, or Salvador Dalí, he was born in 1904, a northeast part of Spain. And at the time that he was born, unfortunately, he was seeing, at maybe the age of 10, veterans of World War I coming in. And if you remember, the plague of the influenza was spread out by these veterans. In his area, he was seeing congenital diseases. He was seeing people that had diseases such as congestive heart failure or obstructive pulmonary disease, and he incorporated it in his art. I will give you some examples here. So he was around 17 years old when he painted this, and he is painting himself as a sickly child in Self-Portrait and Catechist. Look how the beautiful hues of gray and blues that he is using in his hands and in his face. These fingers that almost look like spider or vampire-like, we call that in medicine arachnodactyly. But that actually, he didn't have this. He is exaggerating it. And I believe that he probably saw in his community people with something called Marfan syndrome. You probably have heard of that. his use of blues, and maybe not for the purpose of cyanosis or of lack of oxygen, but maybe to give us a mood of what this gentleman is doing. He is painting this gentleman with a blue, with a Raphael-like neck. This was painted in the same year, and due to the purpose of his exaggerated neck, also considered Raphael-like neck, this is a self-portrait of his, and I just want to point out his use of blue hues again around his eyes, around his forehead. Now, he could have done that because he was trying to imitate Picasso's blues time, but I'm very interested in this because there was another painter that used to like to use blue hues. Now, Van Gogh, while he was hospitalized, he liked to use yellows, but there was a purpose in Van Gogh of why he painted blue hues around his eyes, his temporal area, and around his frontal area. This painting of Van Gogh before Dalí is his physician, Paul Gachet. And Paul Gachet has a very interesting plant next to him that you know as foxglove. The official name for that plant is de Galera, and that foxglove is where you extract digoxin. Digoxin produces a blue hue cyanotic-like around the face. We'll get back to digoxin and Dalí a little bit later. As he is seeing World War I veterans coming in, he is seeing a lot of disability. And I've got to remind you that when you're seeing artwork by Dalí, either in our museum here or at Museo Teatro in Figueres, you're going to see objects that are going to recur over and over again that have some symbols. Sometimes they mean different things depending on the painting. For example, here, he, of course, got impacted by a lot about the veterans that had disability, so he used a lot of canes. And canes, for our purposes, and for later on when we discuss several other of his paintings, means support. He also saw a lot of congenital diseases such as hydrocephalus, which is a lot of liquid and fluid inside the brain, and it produces malformation of the head. Here in the title of this, Average Atmospherocephalic Bureaucrat in the Act of Milking a Cranial Harp. Both the cranial harp is hydrocephalic, supported by a cane, and the bureaucrat also has the hydrocephalus. The next congenital disease, he has never mentioned this, and it is my theory, and I have not proven it yet. I will. So us docents love this average bureaucrat painting. Unfortunately, it's not in display right now. But in the back here, you see this shadow, again, symbol of a piano, again, symbol that sometimes means good and sometimes means bad. Here in this painting, we think it means a bad thing because we docents like to tell the public how that Dalí's father used to teach his sister and him the consequences of premarital sex by leaving an atlas of sexually transmitted disease on top of a piano. Dalí being Dalí, I think he researched back front to cover this book, and his images had an impact on him, which brings me to this painting right here. And it's old age, adolescent, and infancy. And what you're seeing is three busts. And it's a double image in this wall of an old age, a adolescent, and an infant. And the one that I am particularly interested in, my theory is of this infant. Do you see the woman here? Her head is forming the right eye. This belt is producing, the beaded belt is producing supposedly teeth. And so this is a bust here. Let me expand it for you and let me explain so you can see it here a little bit better. See these teeth? They don't look like your typical milk teeth. And Dalí was not shy about drawing surreal, strange figures. But this particular bust is much more deformed than the other bust. And this teeth resemble this teeth right here. These teeth are from congenital syphilis called Hutchinson's teeth. And believe me, this has already been illustrated. Syphilis has been known to man since there has been mankind. and it should have been, if there was a book and it was photographed, it was there. Moving on from congenital diseases, let's now talk about psychiatry and a little bit about neurology. The surreal movement was moved by Sigmund Freud, by his Oedipus complex, by his psychoanalysis, by his dream interpretation of dreams. This is a sketch of Sigmund Freud by Dalí. I'm not going to get into why Dalí shaved his head and put this sea creature on his head, but it has to do with the Oedipus complex. He painted a lot the father and son relationship in a lot of his paintings. But he also used a lot of ink blots to perform his art. Here he painted this and said that this looks like a donkey. Here are his ears, here's his eyes, this is his nose. And then when you flip over the image, now it becomes a grasshopper. Antenna, head, claws. Before I go on, I have to tell you something that I tell all my medical students when they come here, especially my PA students. Dalí, yes, he was a genius. He used to wonderful artist, even more of a writer. He was a jewel maker. He worked with so many people. But you know what made Dalí great? That he read and read and read and was a researcher. So I disagree with Peter. If you're looking at me, Peter, I think out of everything, that was his greatest quality. And I tell my medical students, if a genius like that had to read so much, what does a mere mortal like myself have to read? So maybe we have to put the phone down, stop looking at Instagram and Facebook. It is through his constant reading that he came across the Scientific American in 1973 about the recognition of faces. Here, that is why he started on our gala contemplating the Mediterranean Sea, which at 20 meters become Abraham Lincoln. And what the article was looking at, what is the minimal threshold that the brain needs to put together a recognizable face or object? So he was working on neurology and optics. It was through his constant reading that he came across this photograph in Life magazine in 1965 by Ronald C. James, and a lot of an optical illusion where you can see the Dalmatian dog. He put it in his hallucinogenic toreador that I have expanded for you here. But this is fantastic. This is one of my favorite paintings. He used to give homage to his heroes. And one of his heroes is Diego Velázquez. Now, Diego Velázquez is a fantastic painter in the 1400s in Madrid. He painted La Infanta. And one of my favorite paintings is La Meminas also in El Prado, where she is in there too. Well, he painted Diego Velázquez here. He's painting La Infanta, this painting that Diego Velázquez did right here, right? This is the Museum El Prado, and of course, it's 1400s, so there's no electricity. So that's why you see rays of light coming in, because there should have been windows. So this was in the era of his nuclear mysticism phase, which is my favorite era of his. And what you're seeing, all of this fireworks, is when he was studying about electrons colliding together, and that's why you see all the fireworks stuff here. And what his representation of in some sort of optical illusion is of, you could see her head, her hair, her hands, and her dress. It is through his constant reading of everything that he came through the Nature article about two of three of my favorite scientists, because we know that there was a female scientist before them that described the DNA molecule. And they described this in Nature in 1953, and he was able to later on paint galaxy-ribonucleic acid. He has had a great impact in the medical community, then and now. This is a medical illustration. This is inspired. This is not his work, of a cardiac cath. You can see the heart, again, support from canes. This is actually his work replicated in the front cover of an infectious disease book. And these are two conferences, one in immunology and one in neurology, that started with his paintings. Now, let's get to the meat of it. How does this help us teach healthcare students? But before we get to that, even his body parts, even Dalí's body parts, are now forever in the medical literature. Let me give you an example here. This is a 76-year-old gentleman that came to me, and he was taking digoxin. And see that particular scooping of the ST? Does it remind you of a body part of Dalí? His mustache. So when we say with a lot of honor, Dalí's mustache, you can see it here. I'm sorry I'm presenting my own work, but this is me painting one of my colleagues. His name is Checo, and I titled this work, Checo on Dalínian digoxin. And you could see the bluish hue because he's cyanotic from digoxin, and you can see his mustache. I promise no more work from me. So you could have predicted, well, I'm pretty sure he's just going to talk that art can help students describing rashes. And you're right, but there's so much more. In medicine, we describe things as flat, raised, macule, papules. We say the size and so forth. But surreal art, even though I had a visceral response when I started coming to the museum. Now that I have understood it, sat with it, and desensitized with it, I use it a lot because it tells so much of a story. Just by looking at the bather, you know that this person is in pain, right? He either has gout or has a rash, or the poor soul lost that thumb. But you would say, I'm still not convinced, Andres. I think they should be with the patient. They should be describing it. I know they can't spend time in it, but that's the best place to do it. Well, it's hard to stay with a patient or start with a photography like we can do with a painting, number one. And number two, these surreal art, you would also state, I don't think they need to be seeing this rare, gross painting that I just don't understand. Now comes the image that I will tell you to look again because it is disturbing. Here it comes. Please look away if you can't. Nature is surreal and unforgiving. Cell replication is unsurreal. And this does not fit your cookie cutter macule, papule, raised erythematous. You could look now. So I ChatGPT'd, give me a lecture on Dalí and medicine, and it gave me pages and pages, but I liked one thing. And what it stated is Dalí's art and a good history and physical brings out the complex truth. And that is so right on. Because patients don't come with one single thing. And there's a lot of psychosocial issues that are going on with the patient as well that we have to resolve. The way that I can get the complex truth when I admit a patient is by doing a history and physical examination that is thorough. And I can tell you that when I take my PA student or my medical student and I see that there's an area of improvement, any of these things I can come in and there will be an artwork for that. An app for that, an artwork for that. Maybe it cannot help me with an allergies, and labs, but then everything from imaging to obtaining a family history, and later on I'll show you in problem list and assessment and plan. Why? Because art can help us do pattern recognition that helps us diagnose diseases and syndromes. But before we go all into that, the more experienced the medical student or the physician, we all have inherent bias. We all then start getting prejudice. We all make mistakes and don't want to commit them. There's a lot of liability out there, so they want to protect themselves. So we have a lot of issues that we put in and we come to conclusions right away, which gives me this painting. I have to state that I was not a fan of this painting when I started, and now I can't stop talking about it because I got time with it, I understood it. And so do our patients, right? So what I do with this and especially with my PA students, I say, I want you to describe the mood. Maybe they can state something about the physical examination of the strong arm. How does it feel to see this young lady being touched by that strong arm? But most of the time, I just tell them, just think that this is a patient that is in the emergency room, and the ER is calling you that needs pain medication. Would you give the patient pain medication? And the more experienced the student, right away they would go, no. Okay? Then I will give them a little bit more information about the patient, maybe a little family history. Okay? And then I do what all of us docents do. I show them how this painting started in 1921, right? What I'm trying to do with this is trying to get away from first impressions. And unfortunately, sometimes when we get a call, let's say to get an admission from the ER is already telling you what they think. And I want them to get away from that. Just like the old saying says, don't judge a book by its cover. My son David says, don't judge a painting by its brushstrokes. In medicine, we say, do not go into your first impression until you do a thorough history and physical. How many times have you had an initial first impression, but when you got to know the person or the patient, your impression changes? Dalí's work in teaching, pattern recognition, problemless, and assessment. And this is where Dalí is a master. This is where, no words. Up in Virginia, when I came to residency, I was taught this that I live by. I give feedback and evaluations to my PA student, and just like Dr. Stangwick in Virginia, ingrained in my brain, I ingrained it in every single student. And this is the way that we can treat appropriately and treat the patient in every way that we can. It is the right process. You first get the problem list, you report the truth, then you interpret, then you manage, and then you educate. There's no one-way valve. There's only that way coming down. You cannot skip steps. You can't say the patient has low potassium, let's give him low potassium. You got to understand why. When I first saw this painting, it gave me a visceral response. I did not like it. But once you get to know it, us as docents, don't you just love it? This actually sometimes represent, for those of you that don't know much about this painting and never seen it, you are the ones that perfectly match what I am going to about to say. This represents me being overwhelmed at 6 p.m. on a Friday trying to get home. Or a complex patient. And I keep talking to, this is the painting that I use to determine problem list, to list the problems. Let me see if I can give you an example of a patient that makes me feel like that. 86-year-old comes in with shortness of breath for 6 days, not eating well, had to be intubated by the ambulance. Why? Because he was found unconscious. He was not protecting his airway. When he arrived, had a seizure, now is on pressors. He has history of depression, diabetes, COPD, alcohol, and obstructive sleep apnea. He has not been taking his medications. His blood pressure is low. His heart rate is high. He has fever. When you do a physical examination, there's stuff in his lungs. His labs are all haywired, and his chest X-ray is infiltrate. For those of you that are not in medicine or are dizzy, this is how we feel when we see this the first time, right? There's a lot of problems. There's a lot of problems. And what I hope that my PA students do is that they give me a list of problems the simplest way that they know it. But the problem is, I'm sorry I'm saying the problem so much, but the issue is that the students are doing what they were taught. They go to their lectures and they're taught to diagnose diseases. What do they want to do as soon as they come to their clinical? Dun, 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 dun. Here's the diagnosis. In doing so, though, they miss a lot of issues. Because when they see all of this, they probably see the shortness of breath and the infiltrate in the chest, and they say, pneumonia, it has to be pneumonia. Well, the differential diagnosis might be other things. So when they do not list the problems and things are not going well, they have nothing to go back to. Here comes Dalí to the rescue. Well, I have them say, and if they don't know anything about the painting, is even better. If they know anything about the painting, I choose another painting. But I go to this one. I say, I want you to see this painting, and I just want you to list the elements. Don't try to assess, don't try to interpret, don't say anything. Just say, so maybe I see a face here. It's yellow. No, just a face. Okay, a face. Maybe I see a horse here. This looks like a weird airplane. This looks like a tree. And this looks like an instrument. Perfect. So name it at the level less. And when they're done listing all of the problems, then they can interpret and give me something else. Well, this is Dalí's face. Look at this horse, looks kind of weird coming out of the cannon. It looks kind of dead. Oh, look at this limp. I'm sorry about the limp plane. This looks like it has no leaves, and it looks like an olive tree, maybe a dead olive tree. This instrument looks like it doesn't have any strings. It might be, and then they can come in with some assessment, and then I will tell them what the assessment of the painter is. And it is fantastic, the results that you do. When you do it 2 to 3 times in the museum and you take them back, spotless. Now this painting, I love this paint. I got a visceral response, just like you, for those that don't know this painting. But this painting does represent me at 7 p.m. in the ICU trying to get out on a Friday. This definitely does. And it goes like this. Answered 16 calls from nurses, 6 personal calls, 3 administrative calls. My wife has called me 3 times and I have disappointed her twice already. Missed calls from mom, 22 secured messages from the staff. Last call from my youngest son. He wants to know when I'm getting home because he needs some help. Done only half of my notes. Not done with any administrative work. Now I have a slight headache. I'm being pulled from every way. I feel in pieces. I suddenly remember my poor uncle that I have to call him and I have to do something. And while the student is asking you, hey, do you mind seeing my last ICU note? The ER is calling you maybe to admit that last complex patient. This represents everything. Maybe this is the perfect place to tell the student, teach him what is emergent, what is urgent, what is elective, and what can wait. And maybe the student at this point in time does not fit any of those 4 squares, and him and you have to talk tomorrow. But what is important is to bring him back. My greatest fear as a teacher, and anybody that's a teacher may relate to this, is that I see an area of improvement or deficiency and not give them the tools to surpass that. The museum can give us this. Why? I don't have my cell phone. Cell phones are fantastic, but you saw how much interruptions I have in the hospital. It is not the place. I dedicate, yes. In front of the patient, they will learn more, but it's not a dedicated place. I don't have the numbers for you here, but it has been shown that our attention span has decreased secondary to constant interruptions. The museum gives us that. I wish I had a picture of one of our security guards. They'll look nicely to you if you're taking a picture, but take a call and you'll see. They turn into something else real quick. And yes, our museum is super busy at times, but I know at what time I can bring the PA students on my free time and talk to them, for a dedicated amount of time. And you would say, I don't buy them. How about the classroom? I teach professionalism in a classroom. And while I'm teaching, I'm seeing students checking their phones, going to the bathroom and talking to other people. You cannot do that in a museum. This is it. I know I say I have my favorite, not my favorite, but this is my favorite. I promise. No more favorites. No more favorites. This is, it has no word, especially because the painting is so small. That's why you gotta, for those of you that have not joined us upstairs, and for those people that are joining us virtually, we get to see it live. You have to see these paintings face to face and not in an image, because this is just the exquisite details of the boats and the background. But then you get to the lady, right, and you see that she's surreal. There's a surreal image. And this painting by the title Weaning of Furniture Nutrition, painted in 1934 by him, helps me talk to them about goals of care, hospice, and one of my students named it, I loved it, losing your short-term memory. And you'll see why he said that, and I love that. A little bit of what the artist intended, and then I am going to mix a little bit of medical knowledge and why I use this painting. Lucia, you have to know a little bit of a past family history of Dalí. Lucia was very beloved by Salvador Dalí. That was his nana. And here he has Lucia sitting, mending a net in this body of water. Very appropriately, the cane comes in to support. And I'll tell you why that's so important a little bit later. See this hole right there? You have this piece of furniture fits right in there. And that this medicine and a medicine cabinet fits in this one. Sort of like a Mimoshka doll. Everything belongs together. Now, I love this, especially when I'm talking about vascular dementia and Alzheimer's, because I tell them, when you are driving and you're hearing music, doesn't that take you to another time and think about a person? Sometimes you smell something and it reminds you of your grandmother, and maybe that brings you to music. This is exactly what he's trying to portray. That's why we can't use photography. How can a photography give you this detail and this story? Alzheimer's is not curable. Everything that the family and the physician can do is support the individual. Support the individual maybe by giving them things that they liked, music that they wanted to hear. Yes, there's recommendations of treating, but it's uncurable. Is there any evidence that using art improves performance in medical education? I will be giving this talk again in St. Anthony's with a lot more data about this. And there was a good article here by Joseph Dalia, and it looked at 37 studies. 15 is art educational implemented in medical students, and 12 in internal medicine residents and neurology residents. And unfortunately, there's, I had this bold where I was supposed to line, but I guess Simone had other plans for me. The methodology, the wide variation in methodology exists, so they couldn't come up with consistent results. But they do state that most likely it would yield statistical and clinical significance of improvement in visual perception and empathy, not sympathy, but empathy. So in summary, what have we reviewed today? We have reviewed the importance of illustrative art in medicine, how disease, syndrome, sickness have, how that Dalí viewed influences art, his popularity in the medical community, how art can be used in improving reporting skills and visual perception, how surreal art can help in complex patients, and why choose to teach at times in a museum. Here is my email contact. It has been fantastic talking to you all today. I hope to see you in our next deep dive, which is going to be so much better than It is not by coincidence that the three next docents are going to be females, because females rule the world. Thank you so much. I don't know if you have any questions. If you don't have any questions, I'll be better. Okay.
That was amazing.
Thank you.
First of all, will you be my doctor?
Yeah.
And secondly, I have been reading a lot lately about how art is being used for therapy for people with dementia.
Yes.
You mentioned it,
Yeah.
and you showed studies that demonstrate that. Could you speak a little bit more to that?
So I have a wonderful colleague by Dr. Maria Hernandez, and she chose to go through the musical therapy, and is what we're trying to talk about. Unfortunately, I don't have the evidence of how much it improves, but it does. And usually, what they do is they come in and preemptively they go through a repertoire of maybe songs that they used to hear or and they see what type of response the patient has. That is a music therapy. And there's, like I said, it's so complex to talk to you about this because even the color of the walls, we consider that. It has to be a soothing color to the artwork that's being used. You don't want to have surreal artistry when you're going to get your teeth pulled. Maybe you want to say Monet lilies better than right than but I'm sorry, I don't have the data for you on that. Okay.
But it's a field that's really being explored.
Absolutely. No, absolutely. And I don't know any hospital that has not invested in some sort of musical therapy, all right, or pet therapy, and there's so much other therapies that are I shouldn't call it non-conventional, but not your typical just medications. Yes. Yes, Dalí.
I was just curious on the two patient references, what was wrong with the 86-year-old man? And what was wrong with that person's nose?
Okay, so thank you. So the lady, the very disturbing image. So the question is, so for the people virtually, was what was wrong with the 86-year-old male, and what was that patient that had the nose? So first, the nose, that was a basal cell carcinoma that the patient had. The female, she actually knew that I was doing this, and she gave written consent for me to show. She wanted to see it, but she's no longer with us. Unfortunately, she had metastasis to the skin. Anything else? Okay. Oh yes, the patient, the complex patient. That was a make-believe patient that I made up. I'm sorry, but it was an aspiration pneumonia after having seizures, being non-compliant to his medication. Yes.
Maybe a little bit off. Great job, by the way.
Thank you.
Maybe a little bit off topic, but you mentioned ChatGPT, and I just wonder, how do you see AI, art, and medicine?
So what a fantastic, have you been upstairs? Fantastic. So you've been seeing what AI can do for us. We had the tapestry of dreams, for example. Did you try that too? For those of you, that's a very heavy question to try to merge the three. I can try to dissect it in maybe two and two. It is amazing to see ChatGPT because you can say, ChatGPT, I'm sorry, ChatGPT, but I forgot my anniversary. Can you do a poem with the word jasmine, color blue? And it will give you a poem in seconds. It is just truly amazing. And the more advanced ChatGPT can even do your PowerPoint presentation. I'm sorry, I can't afford that, so this is why you had to get stuck with this. But in medical school, we are looking at this, especially as you can understand that off the topic, it's no longer that patients Google their disease, now they chat GPT their disease, and they truly get into zebras, and we talk about how costly healthcare is, and now we're having to MRI because ChatGPT mentioned it. So in one way, we're looking at the education part of it. We have to be careful in assignments for the medical students. In a way, we have to be careful with the with the students. I'm sorry, I got off the topic and maybe I haven't answered your question. I don't know how we're going to merge the three. That's a fantastic idea, though. I don't know what's the role for it. Anything else? Well, thank you so much. Thank you so much. Actually, how you doing? There is, thank you for the question, by the way.